In the previous session, you heard about how communities can leverage low-cost sensor technology to address poor air quality, which is critical to societal resilience because of its effect on both public health and climate change. We now turn our attention to the front lines of resilience, where civic leaders and policymakers face seemingly impossible situations. They must make key decisions in the early stages of any crisis when data is scarce, information is incomplete, and scientific predictions are just that, predictions. In this session, Eric Horvitz, Microsoft's Chief Scientific Officer, leads a panel of researchers who engage across industry, academia, and government. They will discuss how Microsoft is working with civic leaders, policymakers, and the research community to develop new techniques that can improve tools and their accessibility for making decisions when crisis looms amid uncertainty and ambiguity. They'll explore ways to help those on the front lines cut through the fog of uncertainty that can make difficult situations even worse by exacerbating confusion. And they'll talk about how uncertainty can be more effectively communicated to policymakers and to the public, especially during global emergencies.
Hello, I'm Eric Horvitz, Chief Scientific Officer of Microsoft. It's my honor to moderate today's panel discussion on going from scientific understandings and uncertainties to decisions and policies under uncertainties to address global threats. Please welcome our three panelists, Beth Blauer, Simon Frost, and Alex Long. Beth Blauer is the Associate Vice Provost for Public Sector Innovation at Johns Hopkins University and the former Executive Director and co-founder of the Centers for Civic Impact at the university. She spent her career working to improve people's lives by bringing data into government's decision-making processes. Now, Beth's been instrumental in creating and maintaining the data that drives the Coronavirus Resource Center, which governments around the world turn to for decisions on how to manage the pandemic. Simon Frost is a principal data scientist at Microsoft Research. He's also a professor of pathogen dynamics at the London School of Hygiene and Tropical Medicine. Simon has pursued models and insights about the dynamics and evolution of infectious diseases. He's a member of the Microsoft Premonition Research Group, and this team uses robotic smart traps and cloud-scale genomics to monitor for the rise of pathogens. Alex Long is a program associate for the Science and Technology Innovation Program at the Woodrow Wilson Center, where he's project manager of the Earth Challenge 2020, working on mobilizing the global public around 6 human and environmental health-focused research areas through citizen science. Alex also serves as policy fellow with Cambridge University's Center for Science and Policy to research global health challenges. Well, thanks to all of you so much for joining me today. Looking back on the last 2.5 years, there's been an ongoing accrual of knowledge and a shifting of hypotheses, inferences, and uncertainties about COVID-19, including its spread, its pathogenicity, effective therapeutics, our ability to vaccinate populations quickly, and ideal public health policies. Decisions and larger policies have been formulated amidst standing uncertainties. Now, considering known and unknowns, the pandemic has highlighted the challenges of developing responses amidst changing knowledge and dynamics of our uncertainties. Large-scale data, statistical modeling, machine learning, causal inference, as well as clinical trials and observational studies, these all play critical roles in our understanding of what we know and don't know at any point in time, enabling us to characterize our uncertainties, whether informally or formally via mathematical quantifications of uncertainty, and whether formal or qualitative under the press of real-world challenges, we need to formulate and guide policies given our understandings and uncertainties. So we'll be discussing with our panelists today these challenges and opportunities for making inferences from data and identifying policies amidst uncertainties about our understandings on complex challenges like COVID and climate change. We'll explore how data, machine learning, mathematical models, and experimentation can support decisions under uncertainty and how effective approaches to action under uncertainty can lead to more resilient approach to these challenges. The panel discussion today comes in the context of a program that my office launched on pandemic preparedness, where we partnered with 10 teams across the world to develop and refine methods to support decision-making under uncertainty. So there's much to discuss. I'd like to get started. Turning to Beth first. So Beth, data is the foundation of our understandings of complex phenomena like the COVID-19 pandemic. Collecting public health data from multiple sites and organizations across the country is quite a challenge, and I think it's a fabulous accomplishment for you and your team at Johns Hopkins, given what you did with data coalescence. Can you describe some of the things you did to collect and pool data on COVID and the learnings for building a more effective public health data system for the nation and world? And, might it be easier the next time around, given what you've learned?
So a lot to unpack, and probably enough content in there to blow through our
Let's
entire
spend some
time
time on
together.
it.
Yeah. So look, I think we did something that was very routine for us, which was we saw a pathogen in the community and we wanted to start tracking it. And it's something that we've done for lots of other communicable disease, for measles, for some of the other diseases. And the group that, my colleague, Dr. Lauren Gardner, runs as part of systems engineering. And they are looking at how do we track the behavior of pathogens as it relates to human behavior in our systems and in our cities. And so we were doing something that was very routine, which was just starting to collect that information with the idea that researchers would want to be able to track in closer to near time where the disease was and how it was growing and where it was affecting communities. And very quickly realized that there was not any other infrastructure that was built to be able to do this. And so we had to do a few things, which I thought were critically important at the very beginning of this effort, which was create some governance, making some decisions around the fact that we would rely on publicly available data, that we would expose data to the public after we were able to validate it in some way, that we would understand that data, and that we would be able to also share that data with public health guidance, that we were not just going to put data out into the public without it being contextualized with expertise, so that we could guide both the research that was happening, but also the public policy making that was happening. And so from a data perspective, we created, something actually quite basic, which was a bunch of scrapers that went out to publicly available sites that allowed us to kind of automate the pool of data when it was available. We also had researchers that were going out and pulling from social media releases of information that were coming from validated sources, that were coming out of PDFs and unstructured data. Press releases, the French government for a time was using a daily press conference to get COVID data out into the public. So we would attend the press conference, get the data, and that's how we were essentially creating this initial data source. We've obviously evolved it over time. We've built up anomaly detection and processing. So we're doing a lot of in-source validation, but it's all been guided by a couple of values-based principles around relying on open data, making sure that we are getting good trusted data out to the public, documenting our process, and also not commoditizing the data itself. So it is free, anyone can use it. It can be used to support decision making across a whole host of efforts. And we've seen that actually is exactly what happened. The data has been called on billions of times. It's at the center of almost every Fortune 500 company's, decision-making processes for whether or not they're going to, open, close facilities, how they're navigating the landscapes. Governments across the world still continue to rely on the data. It's the center of a lot of press coverage. And it's because it is a novel data set that didn't exist. And so that calls into the sort of second part of your question, which is, has the global public health landscape shifted over the last 2.5 years to understand that this is a gap, that it shouldn't necessarily be a small team at a research university that leads an effort at this scale. And have we learned from this process? And I think, was a really interesting report that came out yesterday from the CDC that really, I think, asked the same questions, whether or not we were prepared. I think the WHO has had some of the same kinds of internal conversations. And, I hope, yes, that we've learned that we have to invest in this capacity, that it became critically important. And in the absence of our anchor institutions in public health being able to navigate expertly with data during this crisis, we gave way to misinformation, disinformation, and a lot of the vulnerabilities that had manifested into, I think, a clunky response to the pandemic.
And I think you know that I'm serving on the PCAST Public Health Working Group, and thanks for your help there with some of your briefings. We're looking very carefully at what we do as a nation when it comes to building a public health data highway. What kinds of learnings that have you picked up over the last 2 years that would help us think this through as a nation?
Well, I think, there are, in the absence of data standardization and any kind of governance, it was kind of a wild, wild west approach. We had definitions that were variable across every geographic granularity. So we had cities, counties, states, the United States government, all defining core terms related to the pandemic differently, which made it very difficult for us to do comparisons, to get near-time information and insights, tactical information to help for informing policy decisions. And so, some of the things that emerged immediately were like, we need someone who can say, this is how we're going to find cases. This is how we're defining testing encounters. This is how we're going to measure positivity. These are the things that would have been excellent. Instead, Hopkins created essentially our own version of a standard and published it alongside our data. And we did see adoption of it. But then when we peel the onion one layer deeper, we don't have, standardized demographic terms that are being used across. So we had over 1,000 different definitions of demographic terms across every geography in the United States alone, which made it very difficult to understand who was being disproportionately affected by the disease or the lack of resources or the inability to access systems. And so, having a much more firm and directive way to get standardized data categorization, collection methodologies out into the public through well-worn paths. There are lots of well-worn paths from the federal government in this country to the state and local governments. And we need to start thinking about what role data plays in those well-worn paths and how we can use the immense amount of financial support as a mechanism for encouraging standardized data reporting.
Now, of course, effective collection of data and standardization and understanding the distinctions and so on, common data models, that's just the first start. Then we have to sort of go from the data to understandings, to predictions, to policies. You've worked with local and state governments on data and decisions. It's even prominent in your bio. So how have you seen uncertainties taken into consideration, let's say, including policies and decisions around COVID-19 over the course of the pandemic? How might we do better with that? I'm curious what your assessment is of going from data to models to policies and actions.
Well, the first thing I would say is that we have a skills crisis in government. And so what we saw early on was we had modelers, and we know we have traditional modelers that work at the federal level, but state and local governments don't have modelers. They don't have modelers, and they don't know what to do with modeling or modeled data. And so there was a conflation that caused a lot of confusion in the early days, if you recall, of people using modeled data to essentially justify some of the results they were either seeing on the ground or how they were disseminating some of their, and we didn't have leaders who understood the difference between what the actuals were and what the model data was telling them. And so I think there's a huge demand for us to do some skilling from every level of government, whether that's at the leadership level, but also to those people that are implementing large-scale change in our communities, to understand how they could use model data to sort of predict and to help understand how they should disseminate or locate resources, but that they also have to use validation data, which is the actual data that's being felt in their communities as a way to address the kind of instant or the issues that are being faced by the communities. And it's just skills that don't exist. It's never been valued. We have some of the best subject matter experts in the world that work in government. They do have antiquated data skills at best. And then when you start to bring in more advanced analytics, when you try to think about automation or modeling, it is just a bridge way too far. And it becomes very dangerous, right? Because then all of a sudden that conflation starts to create mixed messages. It's communicated wrong. And then you start to really bleed, in my opinion, into this distrust, and that distrust really took a hold, particularly in the pandemic response. And so I would start there, and I think that there is some skilling that needs to happen. But then I also think that there is a role for modeling, not just in pandemic response, but in general in the way that we're planning for the future community. There is a huge deficit in the capacity of government to actually use it.
Thanks, Beth. Turning to Simon, your Microsoft premonition work has focused for a number of years on vector-borne diseases like malaria, West Nile virus. The pandemic hit. Can you say more about the project and how you adapted it to COVID-19?
Yeah, thanks, Eric. So Microsoft Premonition is trying to tackle this problem of finding novel data streams that tell us about the biological environment. So for vector-borne disease, that could be the dynamics of mosquitoes or other disease-carrying vectors. It could be trying to understand how pathogens invade into communities and so on. So we've developed these robotic biological weather stations, we call them, that we can place out in the environment, and they provide continuous real-time information on mosquito dynamics, mosquito activity, and using AI ML algorithms, we can identify the species of those remotely, continuously in real time, because different disease vectors carry different pathogens. What we also tried to do is to use that source of information that is relatively cheap to obtain in order to focus more expensive and more limited resources like pathogen sequencing. So the idea is that we want to build an adaptive network that tells us where and when we need to sample. So with that, we're trying to generate both short-term forecasts, what's going to happen in the near future, but also try to support mathematical models that try to go further into the future. So for a project that we have in Harris County in Texas, where we're working with the public health department there, they want to know, is the next year going to be a bad outbreak of West Nile virus? So whilst we can continuously track what's going on in real time and provide situational awareness, we have to turn to mathematical models to integrate with our data. And we're collaborating with various modeling groups for the West Nile virus work, that's with researchers at the University of Washington, to take our data and then to be able to say, well, what's going to happen in 6 months' time, a year time, and try to integrate these various data streams. So we're providing the data, we're providing short-term forecasts, and then allowing our collaborators to use this platform for their own use.
And for the theme of our panel today, what are directions with characterizing and propagating, quantifying uncertainty in the mathematical models that are being built for understanding pathogens? Sometimes people look at point outputs from models and they take them as the best we can do. Curious what you think are great approaches to handling uncertainty.
So we've worked closely with your program on pandemic preparedness, and our project was trying to take various models of COVID-19 and to be able to assess how they approach uncertainty, what data streams they use. And so one thing that became apparent was just how diverse different groups, their approaches they took for different, but basically for the same outcomes, like looking at hospitalizations and so on. So some used deterministic models that ignored the chance variation in disease dynamics. Others used more data sources, for example, human mobility. And when we're trying to look further into the future, then this uncertainty starts to explode. And so you get these two camps of individuals who are trying to create real forecasts, like what's going to happen in 2 weeks' time, something that could be easily assessed, versus those that do projections, conditional on this particular set of variables, what will the epidemic look like? And trying to bridge those two approaches, I think, is mathematically is quite difficult. For our vector disease work, the mosquito dynamics are very strongly driven by climate, and climate, especially these days, is very uncertain. So not only do you have uncertainty in the models, but you also have uncertainty in the driving factors. With COVID, it's quite a simple infection in many ways to model, just a susceptible, infected, recovered sort of model. But things such as human mobility, especially as policy starts to come in, are very, very difficult to project into the future. So I think it's that mathematical way of bridging things in the short term versus things in the long term, and then trying to tie that together with trying to quantify how policymakers make their decisions. And perhaps a lot of this uncertainty that we see, if they're just trying to discriminate between one set of decisions versus another, isn't really that important.
Let me just dig in a bit there. So, part of what we do when we have a model or data, raw data, or some understanding coming through various interpretations of data, whether we use mathematical models or not, leads to reflections and constructions of mitigations and if-then conditionalizations. If I do X mitigation, what will happen? And that is the kind of process we need to go through, I would think, in designing policies. What's your sense about the promise of leveraging, whether we do it today well or not, leveraging model uncertainty and uncertainty more generally for helping decision makers and guiding policy?
So I think it's mostly trying to, what we saw with COVID-19 was that we received some new data and then decisions were made, and things happened so fast that it was almost impossible to be able to go back and evaluate to what extent those decisions were actually good ones or not. So I think that there's also value in looking back and showing policymakers the decisions that they made, and then with the benefit of hindsight and all of these data that we have, and perhaps some time to reflect, sort of try to track what the trajectory of the epidemic might have been in a sort of counterfactual sort of way. And then I think that way models can be very useful in terms of trying to reinforce the learnings from what we've had in the pandemic, rather than just trying to be responsive all the time, which perhaps the COVID-19 pandemic shouldn't have caught us by surprise, especially because we had lessons from swine flu back in 2009. But my concern always is that the COVID-19 pandemic will just fade away in terms of recognition, and then the new pandemic might come along, and again, we turn into this sort of knee-jerk reaction. So I think models and policy can sort of interact in that sort of way if we think we have breathing space in order to be able to review that.
Now, in decision analysis and in machine learning with active learning, we typically take uncertainty and turn it around, and we ask ourselves, given some decision context, what additional data do we need? Have you seen interesting work going on that front of guiding the active collection of data based on current uncertainties?
So when you have a model, and let's say that you've thrown everything into it, it could be stochastic effects, it could be uncertainty in the data that you see, and so you have some sort of confidence interval or credible interval which says what you think is going to happen, say next week or in 2 weeks' time, and you find that it falls way short. What do you do in that particular case? If you have a model that is too certain, but it is giving biased results, then that's not a good model. Alternatively, if you're too conservative and you've put in so much uncertainty that you just don't know what is going to happen, then that doesn't help the decision makers to choose what to do. So I think it's trying to come up with that trade-off, and perhaps you need sort of a sliding scale in terms of those unknown unknowns, that we have some sort of factor that we can scale in order to be able to say if we really are confident about our data sources and our models, which are very important, then we're certain in our predictions or our forecasts, and on the other end, try to say, well, we really don't know, and then we do need to go and collect certain sets of data. And I think in that particular case, those unknown unknowns are often different sorts of models, which themselves come out of the creativity of scientists. And I think trying to address model uncertainty formally, trying to bring different models, different sorts of things together, and almost all the time, ensembles of models work better. And I think we can take many of the models from COVID-19 and we can harness those now and say, well, which ones did work better? How can we weight them properly? And, what does that tell us about the modeling exercise?
Sounds like a great research project, Simon, to look at now that we have a couple of 2.5 years of experience. Turning to Alex. So, Alex, what's your sense about how policymakers have leveraged scientific understandings, including mathematical models, during COVID-19?
Yeah, first I'd like to say thank you so much for having me today. This is a really crucial discussion, especially right now, and something that I think is really important, especially because of what Simon said in terms of the potential apathy people might have to having these discussions in a post-pandemic, yet very much still ongoing pandemic world. So, to answer your question, science was used as a shield in a way that was shaped like a bullseye as well, because the way that policymakers would use science is to some degree a little bit troubling, only because they would say, follow the science, this is what the science is saying, and then they would, follow that. And the next iteration would be, of course, the scientific method coming into play, which is further iteration. And, with new data comes new evidence, comes new directives. But the fact that, in politics, as I think we all probably know, it's much better to, be authoritative and say what you think and then just go from there and not necessarily flip-flop back. But of course, when this was all happening probably back in February and March of 2020, I remember it so distinctly, is when politicians were starting to use the current models and use the current statistics as seemingly law. I think many people understood that this is going to have to change. And how was politics going to, go along with this changing, ever-changing guidance and these ever-changing models and these ever-changing understanding of a virus of completely, unknown origin at the time and, unknown capabilities. So that then, unfortunately, led to real vulnerabilities in people saying, oh, well, the science was wrong here, so now it's going to be wrong forever. And once the initial models didn't necessarily bear out immediately what they said they were going to, because new information came to light, they became lambasted on many different, media outlets, and that did a huge disservice to the modeling community, which I think has so much potential there for really preparing us for the next pandemic, preparing us for climate change, and all of these things. So I was seeing things like people talking about the model bubble bursting, comparing it to almost like a housing crisis, right? And, you know, that is just the scientific method in terms of constant iterations. And then also, dialogue between scientists saying, I believe this, and then, this criticism, but that criticism usually was kept in the journals or at conferences, much not necessarily in the public eye, but when you had very, well researched and credible scientists picking apart each other's work, which is what happens in science, publicly, it almost engendered this sense of, well, they don't know what's going on, so why do I have to follow this, sloping curve saying 15 days to stop the spread? So we unfortunately were at a point where policymakers were using science, and then once the science had to change, policymakers had a tough time articulating that that is fully normal and should have been something that we all expected. And where do I place the blame? In a lot of different places, especially in the beginning of the pandemic. But I will say that our institutions, and Beth, I think, brought this up earlier, especially with like the latest news from the CDC in terms of their restructuring and understanding that maybe we handled the pandemic wrong. These public health and science policy entities like the CDC, like OSTP, uh, it is their job, and the FDA as well, to potentially take this science and then further contextualize it in the way that a bunch of different research institutions like Johns Hopkins, like Cambridge, like Oxford, et cetera, were doing in the pandemic.
So at Woodrow Wilson, you've had a particular interest and focus on engaging with public citizen science efforts and so on. I find your comments really interesting about a potential bullseye and land grab and this challenge with the dynamism and communicating the nature of the scientific method, which includes discussions, updates, new evidence, new modeling, dynamics over time. What might we do better to communicate to the public about uncertainties in scientific understandings, and how could maybe scientists do better at communicating these uncertainties, even quantifying them, as well as expectations for change in understandings to both the public and to leaders?
Yeah, and I would say, at the Wilson Center, my work started in One Health and citizen science, and now has grown into tackling global health and AI challenges and emerging technologies. And our job at the Wilson Center is to act as this go-between between academia and policymakers. So these are the types of people I talk to every day on both sides, trying to say like, okay, yes, the academics have all of these constraints on them, but how do you thread that needle and get the information to the policymakers, but then also communicating the fact that policymakers only have so many hours in the day and like words they can read. So how do we restructure the way that we talk about our science to make sure that we're both having like this mutually beneficial pipeline where we don't get mad at each other in the interim? So uncertainty, I think, and the work that Simon's doing, and the work that we're doing, and the work that I'm helping out with Microsoft on uncertainty quantification, I think is this really amazing entry point to articulating both of those things, right? So I think that on a whole, people understand that if you are working with models and you are working with data sets and you're working, in the virtual world, it's not going to be a one-to-one into the actual world. So uncertainty is going to be built in and baked into every piece of the process of science. And I think that, uncertainty quantification does a really good job at articulating the fact that what we might model for, what we might simulate, is not necessarily what is going to happen in the real world. But when you have a good basis and you bring in uncertainty quantifiers in the beginning, then that allows these real world scenarios to actually look more like the models, right? So understanding that is the first hump I think we have to get over, because I think uncertainty quantification is technical and it takes a lot of time to like fully understand. But I do think that if we're able to get past that and to be, does that mean showing more error bars in these models? Does it mean projecting more like climate when you're talking about, projections for a, pathogen running through a city or a country? I'm not necessarily 100% sure, but I do think that there is a need to then also articulate to people that whatever happens in the real world will then feed back into these models and then inform them to make them stronger. So understanding that truly this is a cyclical process where you need something at the beginning to then affect real world change, to then feed back in and then understand the model better. Because I think a lot of the work that has happened with uncertainty quantification is really understanding what pieces of the model are so important to like focus more attention on in the future.
Thanks, Alex. Let me turn from the pandemic, which has been our focus so far, to other big challenges we face, where science is going to play and has been playing a critical role in our understandings, and where uncertainties are rife. So let's go turn to climate change and uses of models to help guide action, policy, as well as public understandings. What are your reflections on moving forward there with policy formulation and action?
Well, I think that COVID has given us a good playbook of really what we need to hone in on when we have to tackle these more existential challenges like climate change. And, climate change, I guess, can't even be said to be an existential challenge anymore, because if we've all experienced this summer, we very much know that it is at our doorstep. So, but I do mean to say that those projections, of course, are always talked about in the 2030, 2040 realm, which I think for a lot of people might be even too far to fully grasp. Um, and as like the days go on, like what climate change has that pandemic modeling does not have is so much data, so much public understanding that this is a huge issue, and so much history, right? So one of the biggest issues with COVID was there was no historical data that could tell us exactly how COVID was going to change and how the variants were going to be. But we should use this moment and our understanding of how complex it's been to, navigate the uncertainty conversation and quantification around a truly unknown pathogen, and then take those best practices. One, apply this to the next pandemic, but two, it should be easier now to thread the needle on uncertainty when it comes to climate change mitigation, because there is so much more certainty, at least from my vantage point, on what needs to be done. I will say that first off, I think that we have to do a lot of repairing of our institutional trust in the people who are, reporting on science and giving us scientific advice. So that's probably the thing that COVID has, the response to COVID has undermined. So I think first building that back up, but then taking the powers that we have learned, taking all of the work that, many people, the people on this call have done, people who are outside watching this call have done, and streamlining the message and understanding what works and what does not work with people who, might be even more science skeptical than they were entering the pandemic. So we're basically facing a bigger challenge in terms of, I think, scientific understanding, but we have more tools in our arsenal. And I am, wholly optimistic that we can take all of the work that has been done to model for COVID and, intake data that is harder to get than climate data, and then tackle what might be an easier challenge, which is understanding the effects and like what must be done to mitigate climate change's effects that are, already happening.
Thanks, Alex. Let me open it up for more general discussions. Anybody can jump in. I'm curious to hear your reflections on how we might better build consensus views on the scientific foundations of facts, even if you have differences on the values and actions forward. And even if the consensus is that we have a difference of opinions, including shared understandings of the knowns and unknowns, the uncertainties, when we're working as a society to come up with understandings and actions forward with emergent situations. Anybody have thoughts on this idea of building sort of shared consensus views that we can then share with the public and with leaders?
Yeah, I mean, I think from my perspective, in the absence of a corpus of knowledge that is sort of validated, that there's sort of uniform maintenance of, that there is uniform governance of, then actual data that is being produced by lived experiences and by what's happening in our communities and in in our world gets conflated with data that is more uncertain, that is used for the purposes of modeling or for prediction or for automation. And so, if we continue to divest in sort of the fundamental practice of creating a corpus of data in a way that is not deeply aligned to kind of more settled fact or like actual lived experience, then that's going to give way to a further examination of whether or not science can actually have an impact on public policy. And the signals, that emerged during COVID and that continue to emerge is that there is no ambition anywhere to invest in data in the same way that we would invest in cash or the same way that we would invest in other kind of core drivers of the way that we articulate both policy and make decisions. And so, I think for me, that's definitely emerged as kind of a very urgent demand, which is in my opinion, being largely unmet.
Others, any comments?
Yeah, and I think that in addition to sort of making a corpus of data that people can rely on. There are those unknowns that you referred to, Eric, and being able to capture people's sort of prior beliefs about things that can't be measured right now, I think is equally important. So, what is the incubation period and infectious period of the next pandemic? What's it going to look like? And trying to capture that with the expectation that different groups are going to have different sets of prior beliefs about how populations are going to change, how climate's going to change. It would be great for us to have some easily accessible way to be able to look at not only how climate is changing, but how land use might change, how sort of water features might change. That's all going to impact, and that's not real data. That's sort of coming out of people's subjective experiences and beliefs and so on. So having that and having a very clear distinction between them, as Beth was alluding to, I think is equally important.
Let me ask if folks think we're doing enough to develop and refine methods for actually characterizing uncertainty in our models and in our science, and leveraging it to take actions forward under uncertainty with new kinds of tools, new kinds of methods, taking our statistical methods forward into usable tools that let us do that more effectively. What more might we do? Any sense for the directions with our own abilities to take data and understand the dark matter?
I'll just say how I feel. So coming from the, open science and the democratization of data lens, we ask a lot of questions because my other work at the Wilson Center works on, opening up science. So I think that creating more understanding of these processes by making science an easier thing to understand, because opening science is actually, and opening data is actually not helpful unless it is actually fair and open. So fair is an acronym, but it's basically findable, accessible, interoperable, and reusable. So you have to have all of these things around the data that you're putting out to actually make it actionable for communities that might need it actually the most. And until we get to a point where the understanding of data and a building of a workforce that's more understanding of how to actually use this publicly accessible data, I think that will engender a lot more trust in the government, trust in government produced data, trust in just scientific institutions saying we actually want the community, we want the public to come in and be an active contributor in making the US healthier, making the world healthier. So coming from the open science perspective, I think generally opening these processes up, but then also making them accessible to people with, good tutorials and, cookbooks, recipe books that allow people to get from point A to point Z much quicker than they can right now would be imperative.
Let me wrap things up as we're getting to our time now. Maybe all of you just share a quick reflection. What can we do as the research and technology communities to better support policymakers to make informed decisions in the faces of uncertainty and what we know and don't know? Beth, do you have you've been working very intensely in this space for a number of years.
Look, I think, there is a huge opportunity also for policymakers to leverage technology that they already have deployed across their organizations, and to match that with skills. And I think we've spent a lot of time over the last 20 years investing in platforms, and we have not equal the investment in the people who are responsible for actually matching those platforms into solutioning, into policy making, into the sort of translational work that's required for leveraging data and evidence into public policy creation. And so we have lots of capable minds that work in the public sector. I think we need to start investing in their capacity to actually take all of this information that they have, all of the systems that are in place, and utilize them in a way that will be deeply informed and will continue, or at least start to build trust with the community.
Alex?
I think that moving forward, can you repeat the question again? I just want to make sure that I'm answering it correctly.
I'm just asking about the sort of moving forward. What can we do better as given who we are? We sit
Yeah.
in different areas, but we're kind of, I'll refer to us as the technology and research communities. What more can we do to really think through our connections to decision makers to help with decision making under uncertainty?
Thanks for repeating that. I just want to make sure that I had it grasped before I answered, because I think that a huge piece of it is how we view in the science and research community our, quote unquote leadership. I think that spokespeople and communication from a centralized source is so important, and making sure that whenever we are, talking about things that are as broad as climate change or a pandemic, that we have a clear understanding of what types of messages can actually, break through all of the noise. And making sure that people know where to turn to for these answers, I think is what I am really focused on trying to thread. Because if people are able to, log onto a website that is trusted, that has like the information and the data sets for them already, similar to an IPCC for climate change, um, but for a lot of other issues, especially at the national level, I think it would behoove our ability to meet people where they are, on their laptops, on their mobile phones, and say, like, here is the consensus. While there are so many different uncertainties, actually being transparent about them and not necessarily thinking that people can't understand or parse it out themselves, because I think people are smarter than we necessarily give them credit for when we give scientific advice. So by saying, like, here is, a piece of data or a data set that we are really unsure of, but we built it in for this reason, is probably better than, putting something out there, having it have this huge gap, and then saying, oh yes, we didn't tell you, but on the back end, this is where the uncertainty lies. So I think it's about having some sort of authoritative and centralized messaging, while also being completely transparent of, what science has to offer at the current juncture.
Okay, and Simon, let's take it home.
So I'm very interested in sort of user interfaces and user experiences that are focused and honed to the particular questions that some people, want to ask. So, is the COVID pandemic increasing or is it decreasing over time? And, did a particular intervention work or not? So those are quite simple questions that the policymakers want to ask. And I think the tech community can do a lot in order to be able to say, well, what user experience will actually deliver just that piece of information, and sort of blinker out all the stuff that that might detract from making those sort of critical decisions.
Okay, well, fabulous. So thanks, Beth, Simon, and Alex, for an interesting and lively discussion. I think your work, and more broadly, this topic area on quantifying and leveraging uncertainty is absolutely critical to society. So thanks to all of you today for sharing your thoughts.
Thank you.
Thank you.